Hey guys, it's Nurse Erin again, bringing you this week's edition of Don't Be a Dick. This week I wanted to talk to you about pain and reporting your pain accurately to your nurse or your doctor, because this is one of the biggest dick things that happens in the hospital. People come in and they're like, "Oh, I'm dying. I have this hangnail. My pain's a 10. I need a shot of, what's that called? Dilaudid. Awesome stuff. You can't have it for a hangnail. Hangnails generally do not make your pain a 10. Okay, so years ago, the government came up with this great idea. People should not be in massive amounts of pain. That's good. Like everything the government does, they effed it up. Why? Because they're dicks. And they really don't know about medical stuff. They really don't. So they say, nobody should ever be in any pain. Pain is the fifth vital sign. It must be assessed all the time. So now, which I think we did before, nurses, doctors, we come in, we say, how is your pain today? Give me a number between 0 to 10. 0 means zero pain. No pain. You feel all right. Or at least you're not hurting. Doesn't mean you necessarily feel okay. I mean, you can really feel like shit and not be hurting necessarily. Okay, 10 is where you're crying. You're writhing in agony. It hurts so bad. It's like childbirth. That's a 10. Been there, done that. It's a 10. Okay? Just saying. You don't have to say your pain is a 10 to get medication. It is okay to rate it lower. If you are really kind of hurting, and it's uncomfortable, and you're kind of thinking, maybe I need to take a little bit of medication for this, tell us so. That's okay. It's all right to do. If you're hurting pretty bad, that's also okay to tell us. Gosh, I'm really hurting pretty bad, Nurse Erin. I really think I need some medication. Okay, I'm not a dick. I'm going to bring you medication. All right? If you're shoving French fries and cheeseburgers in your mouth and you're laughing on the phone and playing games and talking to everybody until I come in and then you're like, oh, I hurt, Nurse Erin. I would really like a shot of or morphine or, uh-huh. That's not a 10. Don't be a dick. Don't tell me it's a 10 if it's not a 10. You got a hangnail, not a 10. Now, here's the deal about pain, too, guys. Pain serves a purpose. Pain is your body telling you something is wrong, and you should not do things to cause more pain. If you've just broken your leg or your hip or had surgery or something major like that, you should not be up dancing around acting a fool. That's what the pain is to tell you. You try to get up and the pain's like, oh, here I am. So you stop and you're like, I should probably not do that because it hurts very badly. Okay, very badly. Still not a 10, especially if you stop. Okay? There's different kinds of medication that you can take. Whatever your doctor gives you is what you can have. Probably should not ask your nurse for more than what you can have. Okay? Nurses actually go to the doctor and say, hey, this person is in a lot of pain. Can we get extra medication? All right? Be real. We need to know the truth. Don't be a dick. Don't lie to us. Don't say you're in tons of pain if you're not. We're smart. Just a little FYI, nurses are smart. Okay? We went to college. We have seen patients in pain. When you're shoving French fries in your face and laughing at the TV, You probably don't need a whole bunch of morphine. All right. The other thing about pain medication, guys, that maybe you don't know, the more you take it, the less it works. All right. So you really want to be careful about taking pain medication. If your pain is like a 2 or a 3, you might want to suck it up a little bit. Don't be a dick. Tell us the truth. Don't suffer, all right? Don't get so bad that you're really, really suffering, okay? We don't want that. But don't be a dick. Tell us the truth. We like that. 0 to 10. It doesn't have to be the extremes. It can actually be in the middle. That's okay. All right, guys, be good to each other. Let's not be dicks. We got this. Next week, let me know what you want to see. I bet I have an opinion about it, and I can tell you how not to be a dick.